Hi, welcome to the Pediatrician Day at Diaper Days. My name is Dr. Keys. I'm a pediatrician in the area, and Adair asked me to come talk to you guys a little bit about some viruses and infections that you might see in this time of year. Normally, the fall and the winter is when we see a lot of different infections in our kids, and I wanted to just give you a little bit of basic knowledge that might help you get through some scary moments or nights when you're worried. First thing that's important to know is that there are two different kinds of infections. One is a virus and one is a bacteria. Most of the infections in our kids are viruses, and a virus is something that's passed from person to person and can cause an infection in your child. There are also bacteria, which are also small little particles passed from person to person, but this type of infection needs antibiotics, and that's what's important to know the difference. So an infection that needs antibiotics is caused by bacteria. An infection caused by a virus doesn't need any medicines, and the human body can usually take care of it by itself. Some of the signs of an infection in your child are fever, cough, congestion, stuffy nose, vomiting, and diarrhea. But what's most important is kind of watching how your child is acting. So fever on its own just means that your body has an infection. That doesn't mean that it's definitely bacteria. It doesn't mean that your baby needs medicine. It doesn't mean it's a virus. It just means that the immune system is working. What's the most important thing when your kids have these symptoms is to help their body deal with those symptoms. Throughout the winter, you'll see a lot of cough and runny nose. Runny nose and congestion in our babies, the best thing to do for them is to get a bulb suction and kind of suck out their nose for them. They are not able to blow their noses, but that will help them to breathe so much better. In your children that are over the age of 1 year, they can use honey. That's one of the best cough medicines that there is. A little bit of honey with some lemon juice or a little bit of honey mixed into some warm apple juice can help their cough a lot. Another thing that's important when your child has a cold is to make sure that they stay hydrated. So give them lots and lots of fluids in the form of water or Pedialyte or Gatorade if they're an older child. By keeping them hydrated, you can help their body thin out the mucus and help them do a better job to get rid of it. The things that you really need to watch for are signs of your child being dehydrated. So if you're seeing less wet diapers because they're not drinking, or less wet diapers because they're having a lot of vomiting or diarrhea, that's something you need to take them to their doctor for. If you see them having trouble breathing, as evidence in breathing fast or breathing strong, they would need to see their doctor as well. Fever doesn't necessarily mean that they have to go see their doctor if they are more than 2 months old. Any baby with fever under the age of 2 months must be seen by their doctor or the emergency room. If they have a little bit of fever, but they're eating well, breathing well, no problems, it's okay to give them some Tylenol. Call your doctor to see if you need to bring them in, but you might be able to take care of them at home. Those are the biggest things you need to worry about. Fever more than 5 days is never okay, and that always needs to be seen by your doctor. Another thing that's important to understand as a parent as we're going through this winter season is vaccines. Vaccines, or shots as they're commonly known, are very important to help protect our children from these different viruses and bacteria. You've probably seen a lot of information about COVID vaccines, but I want you to know also about the flu vaccine and all the regular vaccines that your baby and child will get and how they work. The way these work is there's a broken piece of that virus or bacteria that is trying to protect you against that goes into the body, usually in the baby's leg, a little bit of fluid, and the body's antibodies, which is like its little army, are formed against that broken piece of the bacteria or the virus. When the real virus tries to come in, those antibodies are already ready and they kill the real virus when it comes in, preventing your child from getting very sick. That's kind of how vaccines work. It has been life-changing how many children don't get chickenpox anymore. They don't get polio anymore. A lot of the viruses and bacteria that our parents dealt with or our bodies dealt with when we were younger, and they're just prevented now, and they don't have to worry about that anymore. So most important things you can do to help keep your children well this fall and winter, definitely get all of their vaccines, keep them away from other children that are sick. And in that way, if your child is sick, don't take them around other people. That's how viruses spread. Get your family vaccinated for flu and COVID. And when children are able to be vaccinated for COVID, go ahead and do that as well. Just continue to keep your family safe. And always remember, as pediatricians, we never are upset about a phone call. So if you are worried about anything, please call your pediatrician's office and speak with their nurse or go in and get your baby checked. That's our job, is to help you take care of your children and to not worry. So if you're ever worried, always call. Thanks so much. Bye.